As you can tell from the title above, it's been a year since I had excision surgery of endometriosis. I got my coffee here. But I'm going to give you guys a brief summary, kind of like what endometriosis is and kind of what it does. And everybody is different, every body is different, I should say. But I've been meaning to record this video for a while because it's been a year on October 5th since I had excision surgery. Today is October 21st that I'm filming this. It's kind of been a very eventful past couple of weeks. I've just been kind of pumping out content and just creating videos, and this is a very much so important part of my journey, although I don't mention it a lot. One of my friends, actually, she's a YouTuber on here, she mentioned, she's like, you don't really talk about that a lot, and I really don't because I don't know, it's kind of one of them things where I had surgery and I just moved on with my life. I don't know, I guess I don't exactly know why I don't talk about it much, but here I am talking about it. So for those of you who don't know what endometriosis is, basically it's uterine tissue that grows outside of the uterus. It causes painful periods. And if you're a dude, this might be TMI, but I'm just gonna explain my experience. I've had painful periods since I was 12. That's when I got my first period. Like to the point where I was sick, ill, throwing up, my whole body hurt. It felt like someone threw me down a flight of stairs. They were very heavy. I was placed on birth control at 16 years old, I think. I was on the Depo-Provera. I did two rounds, well, I did 2 rounds of that and such. Like, you get the Depo-Provera once every 3 months, but I was on it for a while and then I got off and then I got back on it. I wasn't off of birth control for a very long time, and then I went through my 20s and I got the Nexplanon placed in my arm. It's the implant birth control, which I wished I would have never done, just because I feel like it really screwed with my mood a lot, even though I went through a lot of traumatic events since, you know, throughout like my childhood and my adult years. I went through some really hard stuff in life, and I don't think that, personally for myself, I don't think that birth control really helped my hormones or my mood, or on top of everything else, I was just struggling with depression. But to fast forward a little bit, I got off birth control. I'm trying to get the timeline right here. I don't have notes in front of me. I'm just trying to talk from the heart and just have this be a sit-down conversation, because I know when you're a woman, your body is your body is your temple, and it's very sacred. And I think that women really need to stand together on stuff like this. I think I was 25 when I got off of birth control. Maybe I was 24. I can't remember the timeline. Like, life is just lifey and I'm losing track of time. But anyway, I gave myself some time and then I was off of it for a year, and it took a while once I got the Nexplanon removed out of my arm, it took a while for my periods to really come back and be like somewhat, I thought, normal. And it wasn't normal. They were extremely excruciatingly painful, and then I remembered why I was on birth control the first time. Now, this is a place in my life where I'm still kind of feeling the same way, but I was on the fence about having children, and I thought, well, I've seen so many people in my life, I've seen so many cases where women don't have children until they're in their 30s because they don't meet their partner, or they're just not ready in their life to, they're not ready for that stage of their life yet. And if you're anything like me, I'm kind of a late bloomer too. When it comes to the regard of having children, I'm gonna adjust this a little bit. That's better. So, yeah. I decided to get off birth control. Periods came back painful. I told the doctor, I was like, hey, something's not right. Like, you know your body more than anybody else. And if you're anything like me, you have an extremely strong intuition. I've been called crazy my entire life because I know things without knowing how I know things. Whether it comes to me or other people, I just have that strong gut feeling about things. There were a slew of doctors that were like, oh, let's just put you on birth control. They kind of tried to brush it off. And at this point, I was starting to get frustrated because I was like, something isn't right. And at the time, I had a friend that went through excision surgery. She's like, Ty, I think you have endometriosis. So I went to the doctor. I told the doctor, I was like, these are my symptoms I'm having. I'm having painful periods. I'm having really bad mood swings. I feel like it kind of felt a little loco sometimes. And I was like, I don't feel like myself. My depression was really bad. And maybe that had something to do with it, because when you have endometriosis and, something in that regard, it really screws with your hormones, it screws with your mood, it screws with irritability, it messes with a lot of different aspects of your life. And I remember going to this doctor appointment. Sorry if you hear my neighbor's dog barking every time I film, I swear. Anyways, I went to the doctor, and this was in, oh God, I'm trying to get the timeline right here. I think this was in, yeah, it was January of 2023, I think. Yeah, I think it was January of 2023. I'm trying to remember off the top of my head. But anyway, I went into this woman doctor and she starts going through my chart. And I'm not saying all physicians are like this. I'm not bad-mouthing the medical industry. This is just my experience coming from a patient. And this lady decides to pull up my chart and she goes, "Oh, I see you struggle with depression and blah, 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 and all this other stuff." And she's like, "Were you getting treatment for it?" And at the time I was in therapy and I was no longer on medication because my body metabolizes medication so quick, it just quits working. And then by the time you know it, I'm on the max dose and boom, antidepressants don't work anymore. I'm like, that's awesome. So she's bringing all of this up while I went in for my wellness check. I went in for my woman issues. I went in for my physical. And let me tell you, I have never felt so gaslit by a physician or the medical industry in my entire life. Again, I am protecting myself here when I say that I'm just sharing my experience. She pulled up my chart and she goes, "So, are both of your parents alive?" And I was like, "No." She's like, "Well, what one died?" And I said, "My mom." "Well, how did she die?" I said, "Suicide." It should say it in my chart, right? She goes, "Well, I see here that you struggle with depression. Are you getting treatment for it?" This is when she started asking me questions about my mental health. Like, I felt like she was trying to call me crazy. And I was like, yeah, I'm going to therapy. And she's like, well, then when she found out about my mom, she goes, "Oh, how often do you have those thoughts?" And at this point I was like, "Lady, you better stop talking or I'm gonna, something's about to happen." I was not a happy camper, and I don't know how I held my composure in that appointment, but I was so flabbergasted and my mind was so blown that she would even say something to me like that, especially being a patient. The empathy was out the window. Empathy was gone. I felt more comfortable talking to a man about my woman issues than a woman doctor at that rate. And she just kept going and on, and I just felt so uncomfortable to the point where I was like, I mean this respectfully in the nicest way, but I don't want to proceed with the pap smear because I was just done with her shit. I was so done. And I didn't want her touching me. I went into defense mode and protective mechanisms, and that's just how I'm wired. Like, I just didn't trust this woman. And I got my OB referral, and I was like, I would like her. She's like, "Well, I can get you an OB referral," because she knew at this point I was pissed off. And I was like, okay, got a pelvic ultrasound scheduled, and in the pelvic ultrasound they found that I had cysts all over my ovaries. And then I could tell in the voicemail that she left me, she felt really guilty for the way that she treated me because they did find some stuff on my scan. And at this rate, I was in this Facebook group called Nancy's Nook. It's a support group where people do have endometriosis and people have recommended specialists and stuff like that. And I went on there and I heard about Dr. Heegard, and I was like, I just intuitively, I was like, I need to schedule an appointment with this guy. And so I took it upon myself. I cried all the way home in that appointment, and I waited a little bit, and I gave myself some time to kind of digest what I just went through, because for years doctors were telling me, "Oh, you're fine, everything's good, blah, blah, blah." And I was like, no, I know something's not right with my body. I ended up meeting with Dr. Heegard within 10 minutes, not even 10 minutes of my appointment, telling him my symptoms. I got to the point where my periods weren't like looking like blood. It was just like black coming out. It was disgusting. It was brown, black blood. Hardly bleeding at all, excruciating pain, feeling sick, just really irritable, just not feeling like myself. And yeah, within 10 minutes of the appointment, Dr. Heegard goes, "Well, I'm pretty sure, about 95% sure you have endometriosis. And if you are someone that has never had endometriosis, and maybe you think you do, I'm not trying to scare you, I'm just sharing my experience, because when you know something's not right with your body, listen to that gut feeling. Listen and get second opinions. Don't feel bad about hurting a physician's feelings if you decide that they're not the physician for you. That's why we go to doctors, you know? You gotta find someone that you're comfortable with, especially talking about personal and intimate things such as women health. Like, that's very personal. And for someone to not give you the empathy or hold that space for you to really talk about how you're feeling, it's time to move on from that person and find somebody who really does care. And those physicians are out there. There are doctors that care. The majority of them do. There's just a few bad eggs, and I'm not speaking on the entire medical industry, but Dr. Heegard heard me out. He listened to my concerns. I tracked my periods for months. I wrote everything down. I had proof. Within that same day, I scheduled surgery. I did scans, and on my scans, they found that I had polycystic ovarian syndrome. I had over 20 fibroids on my right ovary and over 10 on my left. Basically, what PCOS is, it's fibroids or cysts that grow all over your ovaries, and it causes I think it's like an overgrowth of, or your body's producing too much testosterone is what I'm trying to say. I'm obviously born female, and people give me a lot of shit because of my name. They're like, oh, I'm not even gonna get into that. But I was starting to grow like chin hairs, and I had like facial hair coming in since I was probably, I want to say 16, 18 years old. I've kind of been dealing with that. So yeah, that's where that came from. That makes sense. And then I was struggling with acne for a while there. Long story short, to get to the actual surgery day, I was a mess. And I started this YouTube journey, and I started documenting the process and kind of, documenting my thoughts, feelings, emotions. I felt extremely isolated, alone. There were a lot of different things that I was, going through in my life. And I felt very alone in this journey. And if you're someone who's going through the journey, or think you have endometriosis, or maybe you have surgery and nobody just kind of understands where your feelings are at, I do. Drop a comment down below and I'll root you on. I will try my best to support you in this. You're not alone. I think that was the biggest thing, is it's basically a hidden diagnosis. Like, they don't know until they go in. It's a blind surgery. You don't know you have endometriosis. A lot of times sometimes it'll show up on scans if it's super bad, if it's like a stage 4. But in my aspect, it did not. So when they went in, they found that I did have stage 2 endometriosis, and they took it out, and they showed me pictures, and they took out my appendix at the same time, because a lot of times endometriosis can disrupt your appendix. It can grow around it and cause more issues. So Dr. Heegard was like, well, as long as we're in there, we might as well yank it out. And I'll insert some clips here, or see if I can show you now. I don't know if this, yeah, I'm not gonna try and show you my scars, but they cut me open in 5 separate spots, and I'll show my scars. All right, so here we are in my dirty mirrored bathroom, but these are my cuts. I got one here, 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 and then there's, see if I can zoom this thing in. And then I have this guy. That looks better. You can kind of see it better, but here, 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 and here. Those are the 5 spots that I was cut open. I believe that's where my appendix was taken out. But yeah, we're healing up, guys. They're getting more faint as time progresses and it goes on, but the one that I was the most insecure about was my belly button. When they cut it open, I didn't like my stomach. I felt very ashamed of myself. One second, I spilled coffee. So yeah, endometriosis, that whole surgery was very hard for me. The medical staff kind of acted like I was gonna walk out of there feeling like $1,000,000. I was wheeled out in a wheelchair, and let me tell you, that is the worst pain I've probably ever experienced in my entire life, because when you go, I'm not trying to scare you. I'm just telling my experience, just something to be prepared for. I want to give you some tips and tricks that help. When you go in, you get prepped for surgery and all that stuff, and then they put you under, and obviously they end up pumping your stomach full of air. So one thing that I did tell Dr. Heegard to tell his patients is take Gas-X, take gas relief, because the one friend that I did have that did go through excision surgery, she's like, oh my God, my stomach hurts so bad. I had so much gas in my stomach. And the heartburn that comes with it too is just intense. Like, I couldn't lay on my back for probably a week. I had to sit up and sleep. I was very weak. I was very emotional. My emotions were all over the place. I was a mess. I was not okay. I basically had to heal through that surgery alone. So if you were to take me back to exactly a year ago today, I just left my dad's house. I think I stayed at his place for almost 2 weeks. And then I was really homesick, and I just wanted to kind of come home and hide out from the world and just give myself the space to heal and kind of focus on YouTube. And that was during the time that I was trying to, I was thinking about following my dreams, and I just didn't like my job. And that's not the point of this video, but I was just going through a lot of different things, a lot of different emotions. It was very hard for me. It was one of the hardest surgeries ever, and I think it took me a month to actually be able to walk a few blocks. It put me out on my ass, and I'm generally an extremely strong person. I mean, I got 3/4 of my sleeve done on this arm in like 2 days. It was a 2-day session, so my pain tolerance is pretty high, and that surgery was extremely hard on me. Right now I am fully recovered, although I am a little bit concerned that it may have come back. I don't know if it's the PCOS. So since I quit my job in February of this year, I don't have medical insurance anymore, but once I do get medical insurance at some point down the road, I want to go to a naturopath. There's one that I had an appointment set up, and I ended up quitting my job before I went to that appointment because I couldn't take it anymore. I feel like a month off wasn't enough time because my emotions were all over the place. I feel like it wasn't enough time for me to fully heal. And one thing that is an indicator of growing like endometriosis is stress. So I don't think it was good for me to go back to work so soon. I think I did need a little bit more time. So if I could have did anything differently, it would be to give myself more time to just heal and relax a little bit, but that's very hard for me to do. Like I said, I am fully recovered. I'm a little concerned that it came back because I still kind of issues with my period. The last couple of periods I've had have been very painful again, so I'm just like, I'm keeping an eye on it. I'm trying to keep my eyes peeled. I'm still on the fence if I want children or not because I haven't met the right person. I feel like if I did meet the right person, maybe I would highly consider it. So yeah, that's just kind of my journey with endometriosis and my journey with, you know, the medical industry and just kind of going through them things. If you want to go back, feel free. They are some extremely emotional videos. There was a lot of crying involved, a lot of ugly crying. I'm not proud of them moments, but it was really how I was feeling, and I wasn't gonna sit there and pretend like it wasn't happening. So I made those videos to document my progress, and hopefully it might help someone feel like they're not so alone in this life. And I am doing much better. My mood is a lot more stabilized. It also helped when I quit my job. I feel like between excision surgery and quitting my job, I am a lot better. I'm a lot happier. I'm a lot more joyful. So yeah, that's my journey with endometriosis, and this is my 1 year post excision surgery. Also, I did want to put one note on here. One tip to give you if you are going to go under for surgery is make sure you stay on top of your pain medication when they tell you to take something. Take the Oxy when they tell you to. Take whatever painkillers they tell you, because that is going to help your body heal a lot faster, and you're going to be really sleepy. You're going to be really tired, but give yourself the space, give yourself the grace, and if you can, take off 1.5 months of work. Just do it for yourself and fully recover before you go back too soon. You're better off to have too much time off and then figure out you want to go back sooner than not having enough time off and like grieving going back because you feel like shit. So yeah, that's my journey with endometriosis, and if you're someone who needs support, I'm here for you, and I will do whatever I can to support you in your journey and just give you some words of wisdom. I know what it's like to go through these things alone. I don't have my mom here anymore, so I had to go through these woman things by myself, and that was very hard for me. So yeah, if I can be a light in your life and you feel like you don't have the support, I'd love to be that for you. So thank you so much for watching this video, and until the next video, my home bitches, peace out.